campaign for healthy minds, healthy kids. Can I get a woo? We're here in Albany today from all across the state advocating for access to youth behavioral health services. What do we want? Excuse me, you messed it up already. Healthy minds,
healthy kids.
Healthy minds,
healthy kids.
I want to introduce our esteemed council leader of the Healthy Minds, Healthy Kids campaign, the Caregiver and Youth Council, Diane Tanner from Rochester, New York. Diane, tell us New York.
Hi, my name is Diane Tanner from Rochester, New York, and it's such a pleasure that you are all here for the Healthy Minds, Healthy Kids. We are a coalition of caregivers, providers, advocates. I am so overwhelmed because it's where our voices are being heard, our voices matter, and you are going to listen. You know, we're going to be out here where what that $195 million that y'all going to give us this year, and we want this here commercial rate to be passed also for across the board. Everybody can get the health care that they need. Thank you.
Healthy minds,
Healthy kids.
healthy minds.
Healthy kids.
All right, so yeah, you heard it from Diane here, looking for $195 million to be invested into Medicaid services, in home, in the community, upstream, before young people find themselves in emergency rooms, before they find themselves in residential programs. We're talking about the primary side of mental health care for young people, in their homes, in their communities. What do we want?
Healthy minds.
I messed it up. We are healthy minds.
Healthy kids.
Healthy minds.
Healthy kids.
All right, I would love if our esteemed chair of the assembly could step forward. Assemblywoman Simon, if you could say a few words.
I just got a promotion. I'm the chair of the assembly.
Oh, chair of the
Thank you. This is why I don't read the chance either, so I get it. I totally get it. I just wanted to say, number one, I just became chair of the mental health committee, and there's a lot of work to do this year, right? Part of the problems we have is because we have underinvested in mental health care, both at the adult as well as at the children's level. And what do we think happens when we don't invest in our children? Then they become adults with needs that can't be met by the structures that we have currently. So when we invest in children at their ages and when they need it in their homes and their communities, we will allay the need for further kinds of treatments when they become adults. We can stop kids from getting involved with drugs. We can do all of that if we actually provide those services. And what is the biggest barrier to services? The biggest barrier is we don't have enough workforce because we're not paying high enough Medicaid reimbursement rates. And so people are leaving the field. We need people jumping into the field. We need people coming into the field to help our kids. And so this money will go a long way to making up that difference. That's money that we should have invested year after year after year. It's now a bigger nut. We want to invest that now so that we can continue the efforts going forward. So I'm really glad to see everybody here. Thank you all for coming. We need you to keep out and invest and talk to your legislators about support for this. And I'm happy to work with you to request that additional $195 million, which when you look at the $235 billion state budget is a drop in the bucket. Thank you.
Healthy kids. Healthy kids.
Thank you so much, Assemblywoman Simon. I now, got it right that time, I now want to draw our attention to Senator Fernandez.
Thank you. Healthy minds. Healthy kids. Healthy minds. Healthy kids. Healthy minds. Healthy kids.
I'm State Senator Natalia Fernandez, representing the Bronx and Westchester, and I proudly stand for this initiative of $195 million.
That's right.
Yeah. I do because our children matter, our future matters, and if we help our children now do that preventative care that we always talk about, we won't see, and hopefully we won't see, their challenges in the future. It is a crisis that we don't have the workforce in this particular area because it's just not sustainable. The reimbursement rates are not measuring up to what regular people who are in this job need to sustain their lives and their families. It's time that we up the ante, that we bring this big and incentive to bring people into the workforce, that we help those studying to be in this workforce get their degrees to be here, so that our children can get that mental health care that they need. Right now, it's 3 out of 4 children are receiving it. Or not. 3 out of 4 are not. That's a crazy number right now. So we really need to put this investment in. The time is now, and with the world as it is changing and things like social media and also still health disparities that are looming in our communities, we have to make sure this money is there so the workforce can do the care that we know our children and our future need. So thank you so much to this coalition. I'm excited to work with the new chair of the Mental Health Committee and our mental health chair in the Senate, Samra Brook, to make sure that all of our colleagues know how important this is and how much of a difference it will make for the future of our communities. Thank you.
Invest in our future.
Invest in our youth.
Invest in our future.
Invest in our youth.
Invest in our future.
Thank you so much. I couldn't have said it better. Literally, you saw this earlier. I now want to ask Bethany Morgan, a parent from Buffalo, New York, to talk to us about what's at stake and what are we fighting for.
I stand before you to address a crucial issue affecting the future of our children in New York: behavioral health for our youth. The truth is, we are facing a crisis in our state, one that is deeply concerning, but one that can be corrected with the right investment and attention. For the past 3 years, I have come down here and spoken about how this issue has impacted my own family, sharing the struggles that we face and the challenges we've encountered trying to access the care that my children so desperately need. But today, I stand here not only speaking for my family, but for the thousands of other children and families I've met on this journey. Families who are struggling with the same issues and facing the same barriers to care. As a proud resident of Buffalo, New York, go Bills, I'm especially aware of the urgent need for action in our region. In fact, 2 out of 3 children in Western New York who need behavioral health care are not receiving these critical services. This is not just a statistic, it's a reflection of real families who are being left behind, children who are not getting the care they need to thrive. Children's behavioral health has been underfunded for far too long. The growing demands of behavioral health and substance abuse services are simply not being met. And our young people are bearing the weight of our neglect. Right now, our youth are struggling, facing behavioral health challenges and substance abuse disorders at unprecedented rates. These issues are exacerbated by the ongoing stresses of the world around them, from social pressures to the toll of the pandemic, and yet they are often left without any help they need. In New York, the growing demand. As a professional, I'm a drug and alcohol counselor who works in the field. I can tell you firsthand there are enormous vacancy and turnover rates for providers, and despite initiatives, we still face significant challenges in recruiting and retaining staff. Even more concerning, there are long-term challenges in getting new professionals into the pipeline, especially BIPOC and multilingual providers, who are crucial to ensuring that every child receives care that reflects their needs and experiences. Families are turning to professionals for help, but what they often find is a shortage of providers, long waiting lists, and limited access to care. When children cannot access timely and effective behavioral health or substance abuse treatment, the consequences can be devastating, leading to academic struggles, family dysfunction, and in some cases, tragic outcomes. This is why we are asking for an investment of $195 million to address this critical gap in our system. This funding is not just a request, it is a necessary step towards building a stronger, healthier future for our children. We need to invest in the workforce that will provide care to those who need it the most. This funding will go directly towards hiring more behavioral health professionals, including counselors, social workers, psychologists, and those who support them, such as family peers, youth peers, and case managers. It will allow us to recruit, retain, and train the dedicated professionals who are on the front lines of providing essential services to our children. By investing in our workforce, we can ensure that every child in New York State has access to the care that they deserve. We can provide early intervention, effective treatment, and ongoing support to help our youth navigate the challenges they face. This is not just a matter of funding programs. This is about ensuring that our children's well-being is prioritized and that they have the tools to thrive in life. We know that the road to recovery is not easy, but with the right resources and support, it is possible. By investing in behavioral health and substance abuse services for children, we are not only addressing an immediate need, but also making a long-term investment into the future of our state. When our children are healthy, they can learn, grow, and contribute to the communities in meaningful ways. I urge you to support this critical investment of $195 million. Let's stand together to ensure that our children have the behavioral health and substance abuse services they need and deserve. Let's invest in the workforce that will make this possible, and let's give our children the chance to build a brighter, healthier future. Remember, healthy minds,
Healthy kids.
healthy minds,
Healthy kids.
Thank you.
So now I want to call up the famous mother-daughter duo, Carol and Emmy Murray. Come on up.
Thanks everyone for listening today. I want to introduce my daughter Emmy, and basically I'm going to tell a story about what happened. Emmy was diagnosed with autism, ADHD, and a mood disorder at a pretty young age. Today I'm here with her to share the profound impact that mental health and behavioral health wait lists have had on Emmy's education, her well-being, and her family as a whole. Children with autism often face higher rates of co-occurring mental health conditions, which can exacerbate the symptoms of the disorder. It is crucial that all conditions and symptoms be treated cohesively to ensure the best possible outcome for these children. Emmy's case is not, it's happening to kids all over the state. When Emmy was just 5 years old, she was placed on a waiting list for behavioral health services. That wait list extended for nearly 2 years. This is just when Emmy was starting kindergarten. So she was, as I said, 5. Over the course of nearly 2 years, Emmy lost access to the education that so many children take for granted. The things she loved the most were taken away time and again. By second grade, she had been suspended and displaced 7 times, and ultimately, she was pushed out of the public school system altogether. If you're not familiar with the practice of school push-out, I would encourage you to look into it. As a result of all of those mentioned above, she is now being homeschooled. And although she's coming to terms with this is not what she wants. Emmy wants to be in school. Imagine the impact that this has had on Emmy, or any child really, whose critical need for success is routine, predictability, and stability. While she waited for services, she became increasingly isolated, depressed, and overwhelmed by feelings of hopelessness and rejection. Feelings no elementary age child should ever experience. Now, 4 years later, Emmy is still working to overcome the trauma she experienced during those formative years. The impact of being on a wait list for behavioral health services is something that has stayed with her, and she continues to work through this with the support of counselors. As Kate Mitchell, writing for the New York University Review of Law and Social Change, states, while we know that exclusionary discipline practices destroy the lives and opportunities of young people, public schools persist in suspending nearly 3 million students per year, including nearly 700,000 students with disabilities. A disproportionate number of these suspended students are students with behavioral health conditions. Our children in New York State are waiting for help that is not arriving soon enough. No child should have their mental or behavioral health challenges compounded by a system that makes them wait weeks, months, or even years, in Emmy's case, for essential services. Every aspect of the child's life was impacted during this waiting period. Emmy lost hundreds of hours of instruction. She lost confidence and self-esteem, and and lost her sense of belonging in our community. The effects on her family have been equally profound. I had to leave my job to become a full-time parent and educator. This was not a decision we were prepared to make, and we were not financially equipped for a one-income household. And the stress from the situation has taken a toll on our entire family. Advocating for my child's legal rights against the school district has been costly, time-consuming, and incredibly frustrating. And my relationship with Emmy is strained because I'm not just a parent, I'm a teacher, and she doesn't want me to be her teacher, quite frankly. So, it's impacted our relationship in ways I never thought. Emmy's very independent. She does not want to be home with me. As parents, our greatest fear is that the damage done to Emmy due to unmet behavioral needs will have long-lasting effects on her education and future. She is a bright, eager student who, at the tender age of 5, began being suspended for behavior challenges, none of which were her fault. The scars left by those experiences will remain with her forever. In a place where she was supposed to feel safe, build friendships, and learn how to be part of a larger community, Emmy instead learned what it means to be excluded, feel unworthy, and feel unsupported, ultimately with no timely access to the help she desperately needed. The consequences of these delays in care are far-reaching. We risk losing some of our brightest future leaders due to the systematic failures in our behavioral health services. The children waiting for help today may be tomorrow's struggling adults requiring ongoing support. The decision is clear. We must make an investment today. We can either choose to provide children with the timely access to mental health behavioral services they need to thrive, or we will find ourselves investing in a much more costly support system for them as adults. After 2 long years, Emmy has finally completed a year of intensive behavior therapy at home. She is now working her way through 3rd grade with the assistance of wonderful tutors. While we cannot undo the damage that was done to recover the years that Emmy lost, we have faith that she will continue to progress and succeed. We cannot allow this to happen to other children in New York State. We must commit to ensuring that no child is forced to wait for the care they need. Let us invest in our children today so that we don't find ourselves investing in a system that supports struggling adults tomorrow. And I'd like to say a few words.
Hi, my name is Emmy. I am 9 years old. I went to school and now I am homeschooled because I had behavioral challenges and I had to wait 2 years to see a doctor and a counselor to help me. The school kept suspending me and then I could not go at all. Kids have to wait too long to get help. I want to go back to school because I want to be a teacher when I grow up. Please invest $195 million so children and families can get the support they need and we can have good lives.
Fantastic, Emily. Thank you so much, Carol. And I want to call up a parent to talk about their perspective from Long Island to Maribel.
Good afternoon. I am Tamara Bigel, a Healthy Minds, Healthy Kids caregiver, a youth and caregiver council member, and co-president of the board of Long Island Families Together. We stand here today representing countless families across New York State, pleading with our governor and legislators to make an immediate and crucial investment in the mental health of our children. We are asking for $195 million to be added to the budget for home and community-based services, HCBS, and children and family treatment support services, CFTSS, because our children in crisis need help now. The governor's current budget fails to address this urgent need in our state, appropriately funding mental health services for children with complex and chronic needs. Nearly 3/4 of the children who need these services are not receiving them. While there are increases in funding for school-based services and mental health first aid training, these efforts only help newly identified individuals or temporary crises. What about the children who need long-term and consistent support? My son struggled with emotional regulation at home, and despite the support he needed, private insurance through my husband's job administered by Aetna repeatedly denied coverage for home and community-based mental health services. That would have been given if he had been on Medicaid. Mental health is the only field where Medicaid pays more for a wider array of services than private insurance. Like many children, my son would mask his struggles at school and save his most intense emotions and physical aggression for home, where he felt safe. He needed a team of professionals to help him co-regulate, self-regulate, and process the world around him. Youth peer and family peer advocates are essential to supporting youth and families in every setting. Skill builders in the home and community, case managers, and home-based therapists complete the team. Unfortunately, he didn't get that help. Had he received the right services earlier, he would not have faced 5 years of separation from our family. My son spent the ages of 12 to 17 in a community residence, hospitals, and residential treatment center. He went from being a child to a young man, with only the occasional visit with his family. We missed out on milestones like his bar mitzvah, dinners filled with laughter and debate, and simple hugs and kisses goodnight. We lost those irreplaceable moments of growth, love, and support that every child deserves. After nearly 5 years apart, my son is finally home. But even now, we are still struggling to access the mental health services he needs. The insurance system is broken. For-profit insurance companies refuse to cover critical services like youth peer advocates, home and community-based therapy, and even Medicaid is a constant battle. I've had to fight through endless paperwork and delays, despite mailing in my Medicaid forms via certified mail return receipt to a post office box, their preferred address. Medicaid claimed not to have received my forms, and the return receipt was ignored because no one was there to stamp it. Meanwhile, we are forced to travel 30 minutes to see a provider, even though there are several hospitals right near our home. These delays and workforce shortages are not just inconvenient, they're harmful. More clinics are closing due to workforce shortages, and we continue to lose workers. We cannot wait for loan forgiveness programs. Our families need a workforce now. The only way that will happen is to pay everyone from therapists, psychiatrists, skill builders, and peer advocates a living wage, so multiple full-time jobs are not needed to house and feed their families. Our government is putting our children at risk by underfunding mental health care. That's why I'm here today, to demand that the governor and legislators invest at least $195 million in home and community-based services and child and family treatment support services. This investment will provide much-needed mental health support for children and families who are struggling to navigate a broken system. We must also hold insurance companies accountable to ensure they provide services at least at the Medicaid rate, and work to close the gaps in our healthcare system that are preventing children from getting the care they deserve. But it's not just about money, it's about system change. We need better trained case managers who can help families navigate the complex transitions from home to hospital, hospital to residential treatment back to home, and OMH to OPWDD. Parents should not be burdened with the responsibility of filling out endless paperwork and ensuring their child's care is not delayed. Case managers should be filling out forms and reporting holes in care, ghost networks, and insurance insufficiency to the Attorney General. Case managers should be equipped to do this work so families can focus on what really matters, supporting children. Finally, we need a stronger, more responsive crisis system. A peer-led crisis response team should be available throughout the entire state, urban, suburban, or rural, in a timely fashion, with trained social workers and EMTs who understand and can care for children with disabilities like autism and assist in supporting and de-escalating individuals who are nonverbal. A 24-hour response time is not a crisis system. It is at best a linkage to services, and at worst, a witness to the aftermath. In addition, we must ensure that programs like the DASH program on Long Island receive better training to assist families of children with chronic mental health issues. Families need de-escalation, connection, mediation, and support when the crisis is in process, not isolation in a room with a couch to navigate the storm alone. The current crisis response system is failing our children and families. I urge everyone to act now, calling their legislators and governor to invest $195 million in home and community-based services for our most vulnerable children, hold insurance companies accountable, and ensure that a fully funded, comprehensive Daniels Law, peer-led, caboose-style crisis response system, trained to help all individuals, including those with disabilities, in a timely manner, is enacted this year. No child should have to suffer the way my son did. No family should be forced to endure the trauma we faced. We owe it to our children and our families to make this happen.
What do we want? Youth mental health. What do we want?
Youth mental health.
Where do we want it?
Communities.
Where do we want it?
In communities.
Amen. I now want to introduce the chair of the Senate Mental Health Committee, Summer Group from Rochester.
You know, what we're hearing today are the pleas of parents, the pleas of mothers and fathers who are simply asking New York State to care more about their children. We heard today, not today, but we heard in the State of the State, we've seen as the governor has talked about her executive budget, she will fight for our families the way she fights for her families. Well, what these families are telling us is that they're hurting. What these families are telling us is that 3 in 4 children who seek and need behavioral help are not getting it. They are languishing on wait lists. Now, it's bad enough to be an adult that's waiting on a wait list. What do you tell a 5-year-old, a 6-year-old? Every single day that child doesn't get the help that they need is a day that they lose. And what we also know is that if we don't get it right for our children with mental health needs that are unmet become adults with even more complex mental health needs. They become adults who find themselves in crisis. They become adults who unfortunately may need something like Daniels Law to have someone come to them in that crisis moment. That's why I've been proud to stand with the Healthy Minds, Healthy Kids Coalition to get at least $195 million in this year's budget because anything short of that is telling every person standing behind me right now that they don't matter, that their kids don't matter, and that them being healthy and having healthy minds and healthy kids doesn't matter. So I'm standing with you. I'm so proud to stand with you all, and thank you all so much. People come out. This is not what they're paid to do. You all come out, leaving your homes, traveling to Albany to stand here and be the face of the change that we're seeking. So thank you all so much, and I stand with you. I always will until we get this done.
Oh, you spoke earlier? Okay, I'm gonna have to watch that. All right, hold on, we got it ready.
Thank you. There we go.
All right, now pretend like we just got it, and we're gonna cheer. Ready? Go. All right, thank you all so much.
Awesome.
Senator Summer Brook, everybody. We got one more. Come on. You've heard it from families. You heard it from young people. Let's hear it from providers. Wendy Finkel.
Hi, my name is Wendy Finkel, and I work with JCCA, and I'm so proud to be here among these strong advocates for New York State's children. Well, you just heard from parents and young people that they're young people that really need therapy, but they sit on wait lists. Emmy sat for 2 years on wait list. Parents and their children are desperate to get help, but they're told again and again that there are no openings. And while they wait on the wait list, children become more anxious, depressed, and at risk. My agency had children who were admitted to the ER, hospitalized, while they waited on wait lists. It's heartbreaking and it's maddening. Currently, our 2 clinics have 17 children on wait lists. That's not right. Our program that goes into families' homes, CFTSS, has 60 children on wait list. That's not right. We try to match families to our colleagues and other agencies, but they have wait lists too. Clinicians come to nonprofits because they love the work and they want to help children and families. Then they leave because they cannot afford to support themselves and their own families. The rates are too low for services. We all want to help young people in need, but we can't because we struggle to hire and keep staff. We don't have enough staff because we can't pay them enough. Governor Hochul and New York State's legislators, we need your help. We need you to support the Healthy Minds, Healthy Kids rate proposal and invest an additional $195 million in children's behavioral health. We need you to help our kids. Okay, 3 times. Healthy minds,
healthy kids.
Healthy minds,
Healthy kids.